Do you need some more help with OET Listening Part C? If yes, you are in the right place. My name is Rachel. I'm a certified OET preparation provider, bringing you both the advice and the practice you need to successfully pass your OET. Take a look at these questions on my screen, and these are from a OET listening practice exam. What do you notice about the questions? Well, you'll notice that I have bolded the verbs. Verbs are an essential part of answering these questions correctly because the verbs tell us what we are listening for. So I want to do an exercise with you. I'm going to show you these 6 questions, and then we're going to listen to the audio, and we're not going to look at any options. We're just going to listen with literally and figuratively open ears. I want you to practice listening from a whole perspective rather than listening word by word for exact answers. We're going to practice listening at this bigger level. Then in the next video, I will show you the actual questions and we'll do some strategy analysis. But join me for this as we practice. So take a look, questions 1 through 6. What do you notice? Well, hopefully you notice that there are some questions about feelings, so you can see what surprises Jennifer about the issue of hand hygiene routines. Let me talk about surprises with you. If someone is surprised, it usually means it's something they weren't expecting, or something different, or something even shocking sometimes. When someone is surprised, they may also ask questions. Questions are a sign that somebody is engaging with this new information and often means they are surprised by it. Take a look at number 2 and number 6. So we have questions about Jennifer mentions. She mentions something specific, and in question 2 we have this specific piece on recent data on infection levels. So when we listen, we want to listen for when they talk about that, not what do they talk about, but why is she mentioning this? And this is really important. Understanding this is not about listening for just details, but actually the reason behind why she's sharing this to support her point. Notice with number 6 again, she mentions car seatbelts. So this is common where we have mentioning something specific for the purpose of, so to underline her point, and it's the point that we are listening for. Now, number 3, we have a suggestion, all right? So a suggestion is not a definitive statement. It is something where we listen and we see that someone's advising or somebody is recommending. And so she suggests that the concept that hand hygiene can prevent infections, and then we'll have some options there below. Jennifer feels, we see that in question 4, another emotion where it's her perspective. Why? Why does she feel that hand hygiene is particularly valuable? And we know this is a why question because we see the word because. And finally, question 5, the problem. What problem does Jennifer identify with direct observation as a method of monitoring hand hygiene compliance? So notice we have the topic, this direct observation as a method of monitoring hand hygiene, but we are listening out what's the issue with that. And we might hear things like the drawbacks, the downsides, the disadvantages. Those are sometimes things that point to it being a problem. So listen out for all of these sort of things as we now go to the audio. Here we go. The other thing I just want to mention before we start, this is a presentation. So that means when there's a transition between the topics, we have to notice that. So we have to wait for when does Jennifer start talking about, for example, question 2. This can be very challenging. So what I recommend you do, focus on those key nouns especially. So for example, recent data on infection levels, or hand hygiene can prevent infections. We see some nouns, but we also see some verbs. She's going to mention some of those words in each question so we know when she's actually moving on there. So here we go. Let's listen to this audio together, and then I will make some points afterwards.
Hi everyone, my name's Jennifer Seaver. I'm a clinical nurse educator, and I'm here today to talk about something very familiar to us all. It's a routine that can potentially save numerous lives, and one that we've all been taught since we were toddlers. Hand hygiene. This is described by many healthcare workers as possibly the single most important tool in preventing the development of healthcare-associated infections between patients. Infections such as Staphylococcus aureus, Clostridium difficile, MRSA, and gram-negative bacteria. Most hospitals have strict policies and guidelines that we must all abide by. So if it's so important, why do we continue to see such an underutilisation of such a basic practice? Why don't we follow the procedures that should already be ingrained? This, unfortunately, has proven difficult to determine. Let's first put things...
Pause. I want you to notice that last part. She's asking us some questions, right? Those questions are the answer to surprise, that first question there. So note that. And then secondly, we just heard a brief pause. Those are very helpful to identify when the speaker is moving on. So a brief pause. Then she says, let's continue that. And listen again for that last part, moving on there.
Determine. Let's first put things into perspective with new data from the Centers for Disease Control and Prevention in the USA, which found that 1 in 25 patients acquires a healthcare-associated infection during their hospital care. Now, for whatever reason, this figure doesn't tend to set off any real alarm bells in people, but that adds up to about 700,000 infections a year. A little more alarming. The clincher, however, is of those, 75,000 patients die from their infections. That's an incredible number, and one that should shock anyone hearing it, because it's a number that quite often reflects human neglect and forgetfulness. One may even suggest at times laziness. Stopping the spread of...
Okay, notice that pause. Laziness, little pause, stopping the spread. That's your transition marker to your next question. Okay, notice with the data question, first of all, we heard her say data, so that's how we know we're on to that question too. And she gives us lots of different statistics and numbers. One of the issues that can happen is you get so focused on every single number that we actually miss the reason for the question. So why is she giving these numbers? And when you're thinking about that, what point is she making? Are they high? Are they low? Are they expected? Are they unexpected numbers? All those sort of attention to the bigger picture can help you answer this question. Let's keep going and let's hear again that transition to number 3, and you can notice those key words that are coming here.
Stopping the spread of infection.
And let's go back one more time a little bit further so you can hear the full transition.
Times laziness. Stopping the spread of infection by way of hand hygiene is hardly a new concept.
So notice stopping, we see the word preventing, and then hand hygiene, right? So that's how we know we're here.
Its importance was first brought to life in the mid-19th century when it was found that physicians who washed their hands before delivering babies prevented deaths in postpartum women. Such an idea was initially ridiculed, as most new theories are. But even now, after centuries of knowledge, it seems to me we're still, in many ways, ridiculing it by simply overlooking this basic practice. In stopping the spread of infection, even the most advanced healthcare is of little use if the basic principles of hand hygiene are neglected. We have valuable technologies and intricate tools at our disposal to prevent hospital-acquired infections, and yet such advancements can so easily be made redundant if healthcare workers don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable...
Pause. That doesn't sound like genuine advancement to me. Notice she repeats a few ideas in that section that are highlighting, emphasizing the same point. So when you hear that, you hear her mention in a few different ways the same idea. Those are often the clues that lead to your, what is she suggesting? What is she hinting at? What is she saying that we should be doing that we're not doing? So think about that. And let's go back there just so we can hear again. There's a quick move to the next question, number 4, and I'll go back so you can hear that here.
Don't toe the line and simply neglect to wash their hands. That doesn't sound like genuine advancement to me. One of the most valuable things about hand hygiene is that it works for so many different types of organisms.
So notice valuable thing about hand hygiene. That's how we know we're on to the next question. And let's play that one more time here.
About hand hygiene is that it works for so many different types of organisms. And you get a lot of bang for the buck, so to speak. Such great protection from so many nasty things by such a simple and inexpensive action that any person can do with ease. The issue is that you have to practice it at a high level of compliance for it to work. Within a hospital setting, there are so many opportunities for hand hygiene, and it's difficult to get a level of compliance where we're able to make changes to infection rates. What we need to do to combat this is to turn hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor?
Pause. So we're starting to blend question 4 and 5. It may be challenging to know, have we moved on yet? But we actually haven't. You can hear that transition just at the end. What do we hear in this section? Well, we hear there's an expression. I want you to note whenever you hear an expression, there's usually some clues related to the expression for the answer. And that one we heard was bang for your buck, right? So think about that, what you heard. And then when we look at the questions in the next video, I want you to remember that as a strategy to help you find the answer here. Let's go back there and hear that transition one more time as she starts to talk more about compliance. How do we know we're not on number 5 yet? Well, she hasn't got into the direct observation as a method. Once we hear that or similar language, then we know we're into the next part here.
Hand washing into what many people already suppose it is, an instinctive ritual. So how do we monitor people in a healthcare setting without hovering and interfering? The gold standard in monitoring hand hygiene compliance is direct observation.
There you go. So direct observation, we hear the word monitoring. Now we know we're into question 5.
But the reliability of this method to measure true, actual compliance is questionable. This is because it increases dramatically when observers, who are usually well known to the staff, are circulating in the unit. The rates then decline almost immediately once they've gone. Furthermore, being a known staff member also influences this. I'll give you an example. In one study, we hired a student for hand hygiene observation in the same unit as a well-known staff member. We found that the staff member observed close to 70% compliance and the student observed close to 30%. The bottom line is that there's a big discrepancy there. The main problem associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts for...
Pause. So we're transitioning into the seatbelt part. Be careful there. So what happened in that section? We heard she talks about the problem at the beginning. Then she moves into the reasons or the cause of the problem. Then she gives an example. This is great because if you miss the initial problem you can hear the example and then look at your options, and there is an alignment between the example supporting what the answer is there. Then at the very end, she goes into another problem. So be careful. For question 5, we're looking at the problem with specifically direct observation as a method of monitoring hand hygiene. Now, as we transition to the next point, mentioning seatbelts, that's a different issue that we can see here. So let's go back a little bit to catch that shift again there.
Associated with a lack of hand hygiene compliance, I believe, is that humans are not, in fact, naturally hardwired to perform hand hygiene in the absence of sensing a substance on their hands. If compared with the use of seatbelts, for example, most people don't even think about putting the seatbelt on when they get into a car. They do it on a subconscious level, and they're usually not even aware they put it on. That's where we need to be with hand hygiene, hardwired so that we do it without even thinking about it. When a behaviour is hardwired like that, you can always sense when you didn't do it because you start to feel uncomfortable. It's a long process, however, to get to that end point.
There you have it. So notice with the car seat example, whenever they bring in what we call an analogy, so you have car seats and we're comparing it to hand hygiene, what I want you to think about, is this used to show that they are similar in the sense that how people treat car seats is the same way they currently treat hand hygiene, or is it introduced as a contrast or a goal? So car seats, we hear why they're so useful here, and then in contrast, hand hygiene is not currently like that, right? So we're seeing that the car seats is used as we should be aiming to have our hand hygiene like the car seats, but it's not currently there yet. So that can hopefully help you as you're listening for all of these details. You hear examples, you hear problems, you hear solutions, you hear reasons, causes, right? Better than looking at word by word, thinking, okay, they've given me an example, I'm comparing it to something else. Is it similar? Is it different? What am I supposed to be noticing about that? So this is an excellent exercise. If you're just struggling with the listening in general, keeping up with the speed, practicing transitions, noticing what the question is asking you, then I would recommend you can do this with any practice test. Take just the questions, cover the options as you're listening, and then next video we're going to bring back those options. So I will put them underneath each question, and then we'll take a look at the actual analysis of those options and the answers. So make sure, if you haven't already, that you're subscribed so you're notified when that next video comes out, and leave a comment with what strategy do you find most helpful as you listen. I'm always looking to collect them from students, so I want to hear from you in the comments below, and I'll see you in the next video.